All right. Hi, everyone. My name is Sarah Trello, and I'm the Senior Program Coordinator for the Southeast Mental Health Technology Transfer Center's School Mental Health Initiative. We are very excited to have you here for our webinar today, Understanding Executive Functioning Differences Among Autistic Students with and Without Co-Occurring ADHD. We encourage you to introduce yourself in the chat box with your name, title, and location. If you have any audio or technical issues during the session, the chat box is open for you to communicate with our team so we may assist you. Also, if you have any resources you'd like to share or any questions for our presenter, please enter those in the chat box as well. And before we get into the session, we do have a quick disclaimer. The views, opinion, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short, School Mental Health Initiative. We are located in Atlanta, Georgia at Emory University's Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4 that you see pictured here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us with a unique lens through which we can address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And now I'm very happy to introduce our speaker today, Dr. Catherine Pickard. Dr. Pickard is an assistant professor at Emory University School of Medicine and at the Marcus Autism Center. She received her doctorate in clinical psychology from Michigan State University and completed a 2-year postdoctoral fellowship at JFK Partners at the University of Colorado School of Medicine. Her primary research interest is in the translation of evidence-based treatments into community systems that are naturally positioned to serve autistic children and children with other developmental disabilities. Clinically, Dr. Pickard is a licensed psychologist and has a strong background in supporting autistic individuals across the lifespan. She holds specific expertise in parent-mediated intervention for young children, as well as cognitive behavioral therapy for autistic youth who have co-occurring anxiety. And now I'm going to hand it over to Dr. Pickard.
Thanks so much, Sarah, and thank you to everyone for being here this afternoon. This is a fantastic turnout, and I just want to express my gratitude for you tuning in. Like Sarah mentioned, throughout the presentation today, I'll be doing my best to monitor the chat box. Because of the large size of this group, we asked to primarily use the chat box and stay on mute. However, when we get to case studies, depending on kind of how things are going in our time, we may have some remaining time to kind of unmute yourself, but thank you so much for being here, and let's get rolling. I want to make sure that we give a little disclaimer and note on our choice to use identity first language in this presentation. We just want to let you know that within our products on autism, we as a team have decided to use identity first language. So we often say autistic students or autistic children, and we've made that decision in response to a growing neurodiversity movement, really based on the preference of many autistic adults, and in an attempt to really kind of avoid the use of ableist language. But we just want to give the disclaimer that we recognize that that's not the preference of every family and every child, and that many people continue to use person first language. So what are the learning objectives for today? I should give the caveat, this is the first part of a 2-part webinar series on executive functioning in autistic students. The first part of this webinar is focused on common executive functioning differences that we see on autistic students and how these differences are similar or different to those that we may see in students who have ADHD. By the end of the learning session, we're really hopeful. Whoops, my computer got a little crazy there. Let me go back. Sorry about that. By the end of the webinar, we're hoping that participants are going to be able to, oh my goodness, going crazy. describe how often ADHD and autism co-occur, to define executive functioning and really be able to kind of talk through its importance for autistic students, and know what some of the common executive functioning differences are in autism and in ADHD and how those things are similar and different. And then we'll be wrapping up with 2 case studies where we're going to dive in and really think through and take what we applied to think through what are some of the differences that we're seeing in these case studies. But before we get started, I just want to launch a couple of polling questions to get a sense of who's all here today. And so I want to ask, tell us, I know you've introduced yourself in the chat, but tell us a little bit about your professional role. In addition to that, how much of your time do you spend working with autistic students? How much of your time do you specifically focus on the behavior or mental health of those students? And what's your familiarity level with executive functioning and executive functioning differences? So if you wouldn't mind taking a minute to fill out that poll, I'll share it out so we can see who's here today. Awesome. And you may have to scroll down. There are those 4 questions. Awesome. Awesome. I'm gonna give people I see responses still are streaming in. So I'm gonna give 10 more seconds, then I'll share that out. All right. So I'm gonna share this back out. So just so everyone can see who's here today, it looks like we have a mix of a lot of different people, but especially some counselors, social workers, psychologists, behavior specialists, BCBAs, potentially OTs, and a ton of people who indicated other. And so if you indicated other, if you wouldn't mind just dropping in the chat box what your professional role is. And then we asked you about how much time you spend working with autistic students. Most of you are indicating less than half of your time, although some of you spend a fair amount of time with them. And then how much of your professional time do you spend supporting the behavior and mental health of these students, and similar responses here. I am curious to see, so in terms of executive functioning familiarity, it looks like many people are a little familiar, but most people are saying that they're either a little familiar or not at all familiar. So I'm hopeful that you'll be able to kind of glean some information from today's webinar. And thank you for dropping your other profession in the chat box. All right, so let's get rolling. Before we jump into the executive function content today, I just want to give the heads up that as a team over the last 18 months, we've been focused on putting together material that is specifically designed around the mental health needs of autistic kids, and especially those who are being served within schools. Much of this work has been focused on anxiety, and Sarah is going to drop a link in the chat box here in a second that will take you directly to the homepage for this toolkit. And so I'd encourage you to check out some of the resources that are there. That includes both webinars as well as written products and infographics. The content for today was developed directly in response to previous webinars that we've had that were focused on anxiety. In those webinars, we asked participants the question, what else should we be thinking about and giving these webinars? And one of the common themes was executive function. And so that's why we're talking about this today. This presentation is broken up. We're going to start off by giving an overview of autism and ADHD. Obviously, we'll be talking about what executive functioning is. We'll then talk about why should we care about it? Like, why does it even matter for our students with autism? And then from there, talking specifically about what are common executive functioning profiles, if you will. What are some of the common differences that we see in kids with autism and also kids with ADHD? And then we'll wrap up very briefly talking about some assessment tools and a couple of case studies. To start, I think it's important just to remind folks of what I'm talking about when I say autism. And so I just want to remind again people of what kind of the APA, the American Psychological Association, defines autism spectrum disorder as. And that is a neurodevelopmental difference that's characterized, or a neurodevelopmental disorder that's characterized by early and persistent differences in two things. So differences in how individuals use social communication, and differences in the interests and behaviors of individuals. And so what does that look like? When we think about social communication, that often looks like differences in the use of nonverbal communication. So things like how people are using eye contact and gestures to go along with their communication, differences in conversation. So that kind of back and forth, give and return or serve and return that we often do in social interactions, differences in friendships, and also we see sometimes challenges with perspective taking. When we think about interests and behaviors, in this category, we are obviously including things like special interests. So these are interests that are strong and intense for our kids with autism, sensory differences, a tendency to have kind of that more black and white thinking pattern, and then the presence of repetitive behaviors. We know that about 1 in 44 school-age children have autism, and about 4 times as many boys have autism than girls. And that kids with autism, like many other neurodevelopmental conditions, have varying support needs, right? And so how autism manifests and looks for any child varies. And our job is to be thinking about how do we individualize services to match the specific needs of a child, and the specific level of support that they might need. And so this slide is really just to remind us of that, which is that individualized services are recommended from an early age and across the lifespan in response to a changing profile of strengths and support needs. So let's talk about mental health. We know that autistic individuals have a much increased likelihood of having co-occurring mental health challenges when compared to individuals without autism. And so this table breaks down the prevalence of certain mental health challenges, both in individuals with autism and in the general population. Now, obviously, with any condition, there's a range of kind of prevalence based on how these conditions are measured. But by and large, what we see is that, again, individuals with autism are much more likely to have things like ADHD, anxiety, depression, bipolar disorders, and schizophrenia. Today, we're focusing mostly on ADHD, in part because this webinar is focused on executive functioning, and that is a primary and significant area of overlap between autism and ADHD. And just like this slide says, we know that individuals with autism are almost 4 times more likely to have ADHD. So what is ADHD? The goal of this webinar is not to go into great detail about differential diagnosis and what is autism and what is ADHD and how do you tease them apart, but really, again, to talk about how executive functioning manifests in these two groups. And so to give those profiles, I think it's important to also give context as to what ADHD is. And so when we think about ADHD, again, this is based off of the American Psychological Association's definition. We're thinking about it's also a neurodevelopmental disorder that's characterized by early and persistent differences in inattention and or hyperactivity. And so some examples of what that could look like are displayed on this slide. When we think about inattention, that could be things like students making careless mistakes, having a really hard time staying organized, having difficulty following directions, and losing items, losing water bottles, losing backpack, losing sweatshirts on a regular basis. When we think of hyperactivity, some examples of things that we might see there are having a really hard time sitting still, right? Fidgeting and moving about, same thing, having a hard time just, staying quiet, talking to peers, making noises, being on the go. So like that first point, being very active, and then having trouble potentially, within conversation, not interrupting or kind of shouting things out. And again, when we think about ADHD, lots of people, no different than autism, have differences in these things, but we're thinking about, do these symptoms happen early on? Are they persistent? And do they get in the way? Do they make life hard, right? Do they make life hard at home, at school, with friends, etc.? So I think something that's important to know is that prior to 2013, if a child had a diagnosis of autism, they could not also have a diagnosis of ADHD. And so those two things were viewed as very, very kind of separate. If you had autism, then any challenge you had was autism. In 2013, the American Psychological Association released the Diagnostic and Statistical Manual 5th edition, the DSM-5. And in that revision, there were significant changes to how autism was described. And one of those changes was that children could now have both autism and ADHD. I think that history is really important because prior to 2013, there was not as much research that was done on kind of how these two conditions kind of co-occur and overlap, right? And so changes in the DSM-5 really opened up the door for research to understand how these two things overlap. And what that ended up doing is also opening the door to research on executive functioning, which is one of the areas that autism and ADHD overlap in. And so since 2013, there has been a proliferation of research on executive functioning. I feel like in general, it's a hot topic, if you will, and it's particularly been particularly prominent in research as well. So we're going to make the transition to talking about executive functioning and what it is, and some of those different domains of executive functioning. But before we do, I just want to get a sense of what comes to mind when you think of executive functioning. So if you wouldn't mind just letting us know when someone says, a student has executive functioning challenges, what do you think? What's going on with the student? Thanks so much for filling out this poll. All right. Give people 10 more seconds, then I'm going to stop it and share it out just like before, but this is fantastic. All right. So I'm going to share the results out, and I think the take home, at least from what I see, is that we think of lots of things. And I think that to me speaks of just the complexity of executive functioning and the fact that it is an umbrella and includes a whole lot of things. So top of the list is losing or forgetting belongings, followed by what appears to be being easily upset or frustrated. I'm glad that folks think of that. Interrupting others, zoning out in class, and to a lesser extent, having a rigid perspective or being the rules police. So it seems like zoning out, forgetting things, and challenges with emotion regulation primarily. All right. And all of those answers are right, by the way. So all of those things that are listed in that poll are challenges that are associated with executive functioning. And I think that speaks to the point, which is on this slide, which is that executive functioning is a broad construct that includes a set of cognitive control processes, if you will. And so these are, and we're going to talk exactly about what this means, but these processes enable an individual to do things like enable kind of self-regulation and self-directed behavior towards a goal. It allows us to, break habits, to make decisions and evaluate the impact of our decisions, to plan for the future, to prioritize what we do and cope with novel situations. And so it is really kind of, again, a higher order process that allows us to do all sorts of things. And we're going to talk about what are some of the key domains of executive function in a second. Before we jump into, I am sorry, my keyboard is just like extremely sensitive today. Before we jump into what those domains of executive functioning are, we're going to preview a case study. And this case study is something that we're going to come back to at the end of the presentation today. But we wanted to show it now to, again, just kind of prime you for what we're about to talk about. So I'm going to read the case study, and what I would like for you to do is just think about, no different than the polling question, but what stands out to you in this case as being something that would signal an executive function difficulty, right? And so this is the case study. And what I'll have you do is actually drop your answers in the chat box here. So Darnell is in the 5th grade. Darnell has autism and participates in general education. He does well, but he does not like group work and is quick to correct others if they don't follow the rules of the project. Peers are starting to make fun of him and call him the rules police. Darnell does better during individual work. However, he needs support from his teacher to get started completing activities and lots of reminders to stay on task. Without this support, Darnell will sit and stare at his work and has trouble getting started. On the playground, Darnell is observed sometimes not responding to his peers when they talk to him, and often joining in conversations in kind of an off-topic way. His teachers are wondering which of his challenges may be related to executive function. And so I'm wondering if you can, in the chat box, just give me a sense of what you would be thinking about. Awesome. So I see rules police. Awesome. The need to stay on task. Reminders to stay on task. Rigid thinking, focusing, starting task. Beautiful. Task reminders. Let's see. Initiative and self-correction. Rules police, rules police. Planning, rules police. I love that. I love that rules police is coming up. I think that's something that we're going to talk a little bit about today as one piece of executive functioning that I think is really important. Getting started on task, spacing out. All of those things are spot on, right? And I think, what's clear in this example is that Darnell needs some support with a lot of things. But the specific things that folks are flagging related to being a rules police, needing support, getting started on tasks and reminders to stay on task are kind of clear flags that he's needing support in executive functioning, as well as those difficulties getting started on work. We're going to come back to this at the end of the presentation as well. So let's talk about specific executive function domains, right? I think, again, we've already started to hit on the point that executive functioning is broad and includes a lot of different things. So when we think of executive function, what research would suggest that there are several categories of executive function. And we're going to talk about the 4 that are on this screen, and then we'll spend a little bit of time at the end of today talking about one more consideration. So the first is inhibition. So this is the ability to resist a temptation in order to follow a rule. So this could be, right, the student who is sitting next to his best friend, the teacher's talking, and the student is trying to remember and keep quiet and not talk to his friend, even though his best friend's right there. And like, it would be so cool to talk to him. So that's inhibition. Cognitive shifting or flexibility is what tons of people were highlighting in the chat box, which is this piece around being able to flexibly shift one's attention, flexibly kind of take on new ideas, come up with backup plans, and really kind of give a little bit. And so difficulties with flexibility can look a lot of different ways, but being very kind of focused on rules or kind of specific outcomes and having a hard time taking a step back from that and thinking of alternatives is one example of how that might come to play. Planning is the ability to formulate a plan and execute it and to do it relatively quickly, right? So you may be at school and you're asked to start an essay. And this is the ability to kind of think through, okay, what's my big picture goal here in the essay? And then what are the different steps that I need to do and how I put them together to achieve this goal? And then finally, working memory. And this is the ability to hold information that's been recently shared with you and then to actually kind of keep it in your mind, share it back and apply it. So this could be students who have a hard time following instructions, right? The teacher says something and they've missed it or they heard it, but they're having trouble kind of putting it into action. We're going to talk about what each of these domains looks like in kids with autism and students with ADHD. Before we do that, I just want to really hit home, and I would assume that because you're at this webinar, you think executive functioning is important, but I want to hit home why we care about it and why it's important for our autistic students. So we know that the take home is that we know that executive functioning skills are linked to all sorts of outcomes for kids with and without autism. And what I have listed here and on the next couple of slides are those outcomes specific for kids with autism. So we're thinking about theory of mind, adaptive skills, school readiness, and mental health. So when we think about theory of mind, we know that this is a skill, right? Whoops, okay, no, I did not accidentally skip forward. This skill is a skill in which people are able to kind of understand the kind of perceptions and experiences of someone else. And so we know that kids with autism have difficulty with theory of mind to begin with, right? They have trouble reading social situations. But we know that autistic youth who also have kind of these bigger executive functioning challenges have even more difficulty navigating social relationships. And so we see that play out. And then in terms of adaptive skills, this is huge, right? And I think is probably not a surprise to folks here. Adaptive skills are those related to self-help. So things like planning and organizing. For example, later in adulthood, you may need to go to the grocery store and figure out what you're going to get that's going to help you make sure that you have the meals that you need, and being able to plan and organize that, being able to schedule and access appointments, to work independently, to complete school assignments. And so again, autistic kids who have those executive functioning challenges may have greater difficulty independently learning life skills and executing really important things. It makes them at much greater risk to need support throughout their life. Given that the focus on schools and school providers for this webinar series, executive functioning does impact school readiness. And this is again for youth with and without autism. We know that executive functioning skills are linked to all sorts of academic outcomes. And right, we think that that's because many school tasks, school assignments, school requirements require EF skills, like being able to sit still, inhibit your, want or desire to do something else than what, the teacher is talking about. It makes it hard to make transitions and to handle unexpected changes and routines, and to remember things that have been shared with you and follow directions. So there's a lot of research linking EF to school outcomes. And then finally, and I think folks mentioned this when I asked, what do you think about when you think about executive functioning? A number of people hit on emotion regulation. And that is absolutely the case. We're going to talk a little bit about that today, which is that we know that students who have difficulty with executive functioning are more likely to have co-occurring anxiety and depression. And that may be in part due to challenges with kind of just regulating emotions as it is. And these challenges get in the way of all sorts of things, right? Kids who are anxious have trouble participating in class, showing up at school, doing extracurriculars, making friends, and completing tasks. So really important, and is the foundation for a lot of things. So let's talk about kids with autism and ADHD and start to have a conversation around where some of those similarities and differences are in these students. This slide is important, and I think I just want to hit it home hard that both autistic kids and children with ADHD have difficulties with executive functioning. However, the executive functioning profiles of these students are not necessarily the same. And we do have research that's helped us to kind of tease apart what executive functioning challenges are most prominent in autism and what are executive functioning challenges that are most prominent in ADHD, and then where's there some overlap. And so these differences and understanding them, I think, can just be helpful in really distinguishing how might we tailor supports for students with autism versus those with ADHD, and to really be cognizant of what specific challenges students are having. So I want to talk a little bit about cognitive shifting or flexibility. So we know that autistic kids tend to have greater challenges with cognitive shifting than students with ADHD alone, right? And I think that may not necessarily be surprising for folks who work with autistic students regularly, right? We often see those difficulties with flexibility play out at school. And so cognitive shifting, which the term cognitive shifting is very like jargony. I mean, I think flexibility is probably what I would refer to this as. But really what that looks like in school is difficulties with changes in routine, right? What happens when a sub shows up and the schedule is thrown off? What happens when there's a fire alarm and like specials are needing to end early? Those things can be really hard. Like we already saw, this may look like being a rules police and, calling out and having difficulty like flexibly applying rules. And then shifting perspectives, right? Sometimes we see kids get really stuck on seeing something a specific way and really having a hard time understanding different perspectives and understanding different options. And again, I just want to emphasize that kids with autism tend to have greater challenges with that than students with ADHD alone. Autistic students tend to have greater difficulty planning than students with ADHD. And so when we're thinking about this is really, again, when we have a kind of a more complex goal and we need to kind of get started on completing specific activities to achieve that goal. Again, when I say autistic students tend to have greater difficulty with planning than students with ADHD alone, this is by and large the case, right? This is what research tells us. And so how does this manifest at school? This could look like difficulty knowing the steps needed to complete tasks at school, taking a whole long time to get started on activities, and needing reminders or visual supports to complete routines and activities. And so we know again that students with autism tend to have more challenges in this area. When we think about working memory, so this is the ability to, again, someone gives you an instruction, or it could be within the context of this webinar, I'm talking, and it's your kind of ability to kind of process and hold the information that's coming your way, and then to apply it in the moment. And we know that students with ADHD and autism have actually similar difficulties with working memory. So working memory differences at school can manifest again in many ways, but it could be difficulty remembering information that was recently shared, and not processing instructions well. So having trouble hearing and then applying. And then finally, inhibition. I think this is probably not necessarily, again, surprising to folks who have worked with students with autism and students with ADHD, but we know that students with ADHD tend to have greater difficulty with inhibition than autistic kids, in part because that is like a hallmark feature of ADHD, right? And so this can look like difficulty remaining seated, sharing, and it might be a student who's sharing answers without raising their hand first, or touching or fidgeting, doing all sorts of things in class. So students with ADHD have more challenges than students with ADHD have more challenges with inhibition than students with autism. I want to give a note and just talk a little bit about emotion regulation. When you read research on emotion regulation or executive function and really kind of tease and break apart what executive functioning is, it's often broken into the 4 domains that we just talked about: planning, working memory, flexibility, and inhibition. But like a lot of people have mentioned already, students who have executive functioning challenges often have difficulty with emotion regulation. And so even though it wasn't necessarily in the diagram that I just showed as one of those 4 main components, it is something that we often see go along with executive functioning challenges. And so I think it's important to talk about. So we know that, again, emotion regulation, like this slide says, is not a core executive functioning domain, but it is considered highly overlapping. And students with both autism and ADHD have difficulty with emotion regulation. This can look a lot of different ways, but usually it looks like having emotions go from 0 to 100 really quickly. So you think about the student who has challenges with being flexible and a routine is broken and they are on the floor, right? Or they're trying to run out of the classroom. So these are kids who react quickly. This slide is intended to summarize these core differences and how they relate to autism and ADHD. So on this slide, we have kind of 2 overlapping circles. On the left, we have the 2 executive functioning domains that tend to be greater challenges for autistic students. So these are flexibility and planning. And then on the right, we have the executive function domain that is a primary challenge for, or tends to be a greater challenge for students with ADHD, and that is inhibition. And then in the middle, right, we have working memory and emotion regulation. And these are challenges that we see about equally across students with autism and students with ADHD. So these profiles are, again, like I said, they're important to know because when we work with students, right, how we understand their executive functioning challenges is going to impact how we support them, right? When a teacher or a parent comes and says, my student has challenges with executive function, right? It's hard to know like what that means, and so I think this diagram is really meant to help us understand that when these things come up, it is important to tease apart what are the specific challenges of this individual, and what does that mean for tailored supports. And when we work with students with autism, we're going to be paying careful attention to things like flexibility, planning, working memory, and emotion regulation, knowing that these are common EF challenges in those students. I want to just talk a little bit about measures of executive function and how you might like tease apart both A, does a student have an executive function challenge? B, what is the specific challenge? And C, is it a big challenge, right? Is it actually kind of getting in the way and interfering in some capacity? What's listed on this slide here are not our like very formal assessments of executive function that I would not necessarily expect folks to be using, but just so you're familiar with how this would be assessed formally, these are things like Stroop tasks, right, that get at inhibition. So you might, be reading the words, like colored words. So, on a page, you would have the words red, blue, black, green, yellow. But those words are printed in a font that is inconsistent. with the actual word itself. And so it's looking at, how do I inhibit like what color I'm seeing to kind of read the word. It includes tasks like the Tower of London task, which looks at how quickly someone can plan and execute a complex activity, and things like the Wisconsin card sort, which is like how quickly and flexibly can someone make different categories based on cards. All that to say, there are lots of formal measures that are used in neuropsychological test batteries. I just want to highlight that the most common rating scale of executive functioning that is used consistently throughout research literature, and I believe within schools as well, is the behavior rating inventory of executive function, or the brief. This is a measure that's really designed to assess the intensity of executive functioning challenges in kids 5 to 18. It has a parent, a teacher, and a self-report measure available. And the nice thing about it is it's normed on lots of kids. And so because of that, it can actually provide T-scores, which gives you a sense of both like the magnitude of a child's executive functioning differences as compared to their peers. The really nice thing about this scale, actually, and I didn't put this on this slide, is that when it measures executive functioning challenges, it actually breaks them down in a way that's similar to what we were just talking about. So it will give you scores based off an individual's ability to kind of based on inhibition, right, and planning, and flexibility and emotion regulation. So it's a really nice way of helping you tease apart what may be going on, in addition to kind of what you have already observed. So just wanted to kind of share that. So I'm going to pause here. I'm actually going to go back to this slide before I move on to the next, and just kind of give you a sense of where we're at right now. We were able to talk through what are some kind of common executive function differences in students with autism and students with ADHD, and how those profiles may be similar or different. We are going to move back into a couple of case studies, but I think this would be a good time. If there are, Sarah, have there been any questions in the chat box? Okay. If there are questions in the chat box, you're welcome to drop them in. We are going to move into 2 case studies. And the way that we're going to do this is we're going to facilitate discussion around the case studies in Jamboard. And so what I'm going to do is I'm going to pull up the case study, and when we pull it up, I'm going to read it, and then I'm going to stop sharing my screen, and then I'm going to start sharing the Jamboard. And that's going to be used to facilitate this discussion. And yes, the question around the recording will be available after this presentation. So we're going to circle back to this case study that we talked about previously. And so this is a case study of Darnell. Darnell is in the 5th grade, and he has autism and participates in general education. He does well, but he doesn't like group work and is quick to correct others if they don't follow the rules of the project. Peers are starting to make fun of him and call him the rules police. And Darnell does better during individual work. That said, he needs support from his teachers to get started completing activities and reminders to stay on task. Without this support, Darnell will sit and stare at his work without starting. On the playground, Darnell is sometimes observed not responding to his peers when they talk to him, and often joining in conversations in an off-topic way. And again, his teachers are just wondering which of his challenges may be related to executive functioning, and maybe which others are part of his autism, or both. So I am just going to quickly stop my share and then reshare our Jamboard here. And Sarah is going to drop a link in the chat box to the Jamboard. Hold on, let me just pull back up my chat box so I can monitor the chat while I'm also in the Jamboard. Oh, Josie has dropped it in there. So you should be able to click the link on your screen or in the chat box. It's going to take you to this Jamboard to facilitate this discussion. So I'd encourage you to click that link. And we are going to start on, you'll see that there are multiple pages of the Jamboard here at the top. We are going to start on page 1, which it should take you there. And you'll see if you haven't used Jamboard in the past, one of the things that you can do is actually comment via sticky notes. So you'll see there's a menu here on the left-hand side, and the fourth icon is the sticky note. So let's get started. We have a few questions to discuss here. So what executive functioning differences does Darnell have? Right, and I'm seeing people drop things in already. I'm gonna do my best to organize things as they come in. If you're having trouble, oh, it's told me too many people are on that link. If you're having trouble viewing the Jamboard, please drop this in the chat box and I will do my best to move it over. All right, wonderful. So I'm gonna start to group things. Lots of rules police here. And again, we're gonna move into a second case study here in a second. We've already started to talk about this, but I want you to be thinking specifically about what we just talked about in terms of these executive functioning profiles. All right, group work. Let's see, task initiation, not staying on task, rules police. Trouble getting started. I'm going to put that under task initiation here. Rules police. What would be really fun is if Jamboard had like a cloud feature so we could kind of like see how big some things come up. All right, off topic. Yep. I'm trying to pull some of these together. Interjecting into conversations. Trouble getting started. All right, rigid thinking patterns. Awesome. We've got a whole lot of stuff here. This is fabulous. It's a test of my own executive functioning, which is how quickly can I organize everything. All right. Let's see. I'm a little bit off, not staying on task and conversation. Okay. Whoops. Oh no. Shoot. I am going to re-click the link as well. Let's see. Oh no, I'm having difficulty getting back in. But here's what I will do is just talk you through kind of the main categories of what what people were saying, which is that ultimately we have a few main categories of difference. And no different than the earlier discussion, we have kind of our rules police section, right, where we're seeing difficulties with flexibility and difficulty kind of shifting perspectives easily. In addition to that, right, there was the piece around kind of getting started on activities. And I want to tie that back, right? Because when we think about executive functioning differences and those that kids with autism are more likely to have, getting started with tasks is one of them. And so I was really glad to see lots of people dropping in, comments around, being able to start school activities. And then the last being kind of this off-topic kind of interjection within his peer relationships. And that could be, right, it could partially be related to his autism and also partially related to, right, having some difficulty with inhibition and some difficulty kind of interjecting in conversations in a meaningful way. And I think that's a great example of how executive functioning differences can also get in the way for friendships and kind of peer relationships. All right, so I'm going to stop my share really quickly and go back to our slides while we're kind of figuring out the Jamboard things. And I'm going to have my chat box up here. Okay, so the second question, and we're going to move to using the chat box for now while we're just figuring out kind of Jamboard. There's such a large group of people that I think Jamboard maybe got a little funky, got a little feisty with us. So we're going to move to the second question, which is which domains? So which domains of executive functioning do these fall under? And so we've already grouped some of those challenges into those domains, but if you could just tell me what their names are, like what were some of those big categories that we talked about? All right, cognitive, yeah, planning, yes. And flexibility, working memory, absolutely. All right, Jamboard is back up. So I'm going to share one more time here. There we go. All right, we're back at it. Let me just go to the next page and we can move on. All right, which domains of executive functioning do these fall under? And sorry for those who literally just put them in the chat box. If you wouldn't mind just popping them into the Jamboard. We're just talking about, again, what are kind of the formal names for those things that we just talked about? Yep, okay, beautiful. Cognitive shifting or flexibility, I love that. Planning, beautiful. And if you put them all on the same note, that's okay. I'll just, I guess, put them in between. Planning, yes. Having trouble starting activities. He's needing support from the teacher to remind him what to do. Yes, planning and flexibility, kind of, I guess, together. Initiation, thank you. Yes, getting a lot of having a lot of trouble getting started with that different activities. Working memory, yeah. We did not, I guess, see anything related to emotion regulation in this specific case study, but I think that is something that we often see. But yes, flexibility, planning, and working memory were some of the big ones that stood out, as well as this potentially difficulty with inhibition. We're not really sure. He's having some trouble kind of, starting conversations and kind of starting interactions with peers. All right, but we realized that this is a very brief case study. And so if you were working with Darnell, what additional information would you want to really tease apart what's going on and to help you figure out, are these challenges significant, right? Are they getting in the way for him and making things hard? So what questions do you have about him? Yes, thank you. How he performs at home with homework, self-care, social participation. How does he react? And how are his emotions and emotion regulations? How many prompts does he need to stay on task? What types of tasks are difficult for him to start? How does he perform when he gets bad? Oh, how does he perform or maybe react when he gets bad grades? Is he capable to adapt to changes in his routine? What can he initiate and complete independently? How has he functioned in the past? Does his performance differ in small versus large group? I love that. So getting at, like, are there environmental considerations that we should be thinking about that support him in doing these things? Do parents see these things at home? Thank you. What has worked for him in the past? And how is he understanding the instructions? Are language difficulties at the root? These are fantastic questions, all things that we need to know. There are themes that I'm seeing here. What are his skills and interests? Kind of with what's worked for him in the past. Do parents see these things at home? One of the things that I see coming up here is a few things. One is, how significant are these things for him? I really appreciated the question around, how do these things impact him? How is he doing at school? Like, does he have friends, right? Is he able to get through the day? Many people have kind of differences in executive functioning or times when we're really tired and we're having a hard time, right? We forget things, but we want to understand, how often are these things happening and how persistent and interfering there are they? We totally want to know if they happen at home and are they happening across settings? And I appreciate the people who are also making us think through, are there other things that are contributing to these challenges? For example, does he have language challenges? And is that the reason why he's not following directions or having a hard time? And what do we need to do to support him? What's worked in the past? There's a lot. And I think it highlights the complexity of executive functioning and the importance of not jumping to the conclusion, right, that this is a specific executive functioning challenge, but really taking the time to think through what's at play and what could be contributing to these things. And we're going to be talking about this more tomorrow, or not tomorrow, in 2 weeks in our next webinar series, which is around how do we support executive functioning. But right now, if this were you and you were working with Darnell, what are some of the strategies that you might consider to support Darnell's executive function. So what would you do knowing that he has trouble, a little bit of a rules police, having trouble with tasks, visuals. Oh, beautiful. Oh, wow. So good. Okay. Adult assists to get started. Yeah. So having someone kind of there to jumpstart him. The use of visuals, like that people are saying, can also be used to help that. Social scripts, helping him know what to say with peers. Teacher self-regulation skill. Oh, yep. Okay, check for understanding. I'm going to do my best to group these this time. Teach how to ask for help, visual supports, check for understanding, teach how to do this. Hold on. Monitoring progress, role plays. I love this. I'm grouping these in as best as I can here. Regular breaks. I'm gonna put that over here. And I'll talk about my groupings here. Role plays. Okay. All right, so I did my best to kind of group these. I'm gonna put that right here. So rewards, oh, beautiful. Okay. Regular breaks, rewards, adult assist. So the way that I've tried to group these, and I honestly I am trying to keep up as to the best that I can here. How I've tried to group them is thinking through first here, which is that we need to teach him, right? When kids are struggling, we have to understand what are the skills that they may need help, and to actually teach and give them the tools to do it. That could be through social scripts, through role play, but I love all these comments around we need to teach, right? We need to teach first. There may be some pieces around too, how do we use adults, right, and the environment to kind of support understanding. So that could be, and actually I can move this over here too. But really using adults to support him. I love the emphasis on environmental changes. So that could be through visual supports. It could be through regular breaks to kind of support regulation and help him kind of feel better able to come and be present and engaged. And then rewarding good behavior. I appreciate that. Right? I hate that I just said good behavior. Rewarding what we're expecting and rewarding attempts at doing these things. These are all fantastic strategies. And like I mentioned in the webinar in 2 weeks, we're actually going to be diving into, okay, how do we actually support flexibility, right? For example, what does that look like? On this slide, I see a lot of great content, and some of that we'll talk about, and there are also some other strategies that we'll be referencing. So before we wrap up for today, we have one more case study. And so I want to actually switch it up because we've talked a lot about Darnell. So I'm going to stop sharing this Jamboard, but we are going to come back to it. And I'm going to share this second case study one more time. Let's see. I'm also just going to pull up the chat box. When I had the Jamboard up, I did not fully have it on. And so if I was missing chats, I apologize about that. All right, so case study 2, I want to shift to someone who's older. We talked a lot about school kids in the elementary time period, and oftentimes that's because that's when we start to see some of these challenges unfold. But I am guilty of, neglecting how these things look for older kids. So case study 2, Sarah is in 10th grade and she has an IEP with an autism designation. She has borderline cognitive skills and is learning at about a 5th grade level. She has a few friends, but is often observed to interrupt them, say things that appear off topic, or talk persistently about fashion design. Sarah is sensitive to loud noises, including fire drills, the intercom, and loud laughter. Sarah often is late to class, loses her belongings, and/or forgets to complete and turn in assignments. She is easily annoyed and upset when she is reprimanded or learns of her forgetfulness. In these situations, she puts her head on her desk, cries, or tries to walk out of the classroom. And her teachers are wondering whether she may have executive functioning differences in addition to some of the learning challenges that she has. So this is Sarah. I am going to move over to the Jamboard, and we're going to do a similar activity, but specific to Sarah. So let me stop my share and just reshare that Jamboard. All right, so we are on page 5 of the Jamboard. So this is Sarah, you know, and she's older, she's a female, right? And she's a little bit different than Darnell, but tell me what specifically, and what specifically in the case study kind of signaled that she has these challenges. So emotion regulation, absolutely, that stood out to me as well. What else did you hear or see in the case study that signaled potentially some other differences? Yeah, so rigidity, interrupting others, put over here, rigidity, and kind of like persisting in conversations around like the same topic, having trouble shifting that. Yeah, losing things, yes, I'm gonna put these things together. Organizational difficulty, losing difficulties, interrupting others, working memory, forgetting assignments, emotion regulation. This kind of goes with multiple things. I'll put it with emotion regulation, but we have inhibition, right? We have strong interests, which may kind of go over here. Emotion regulation, not turning in assignments, sensory processing. Thank you for whoever, which I'm going to put in its own thing, but we can talk a little bit about that. Emotion regulation, in addition to other things, maybe strong interests. All right, and she is developmentally a little bit kind of behind or kind of below her peers. That's something important to think about. So difficulty with relationships. Yep, we need to know a little bit more about some of those difficulties with relationships. Okay. So please keep putting things in, and I will do my best to keep organizing them while I'm also talking. But I hear people talking about rigidity, right? And this, we may need to know more information, which we'll get to. But this looks a little bit different than it did with Darnell, right? So with Sarah specifically, we see kind of that persistent kind of focus on a topic, and potentially, we're not sure, but potentially difficulty shifting and talking about different things. A lot of reference to emotion regulation, and I appreciate that, right? We're seeing her have a hard time and cry and try and walk out of the room when things get hard, or she realizes that she's been forgetting things. Organizational difficulties, and we also see her kind of with some of those inhibition challenges, not too different than we saw with Darnell. So difficulties with inhibition. I appreciate someone putting sensory processing here. When we see there's specific reference to the fire alarm and having a hard time with loud noises. We know that students with autism, many of them have sensory differences that make things hard, right? When you have a hard time with loud noises and fire alarms are hard, we often see that those situations are distressing, as they would be for anyone who, has a hard time with sensory differences. So I appreciate someone putting this in and really highlighting that is another thing that could be driving some of those emotion regulation challenges. And we're also seeing difficulty with relationships. And the reason I put those off kind of in their own domain is because those difficulties with relationships could be driven by a lot of things, right? It seems like there are multiple factors at play that could be making friendships hard, right? Some of the things around interrupting and kind of rigidity stand out, but there may be others. All right. Oh my gosh, amazing. People have already started to do this. You know how this works. So which domains of executive functioning do these fall under? Inhibition, absolutely. Emotion regulation, yes. Planning and organization, when we think about kind of her difficulties, staying organized. I think a lot about emotion regulation. Working memory, yep. Potentially, right? If it's hard to know exactly what's happening with some of her difficulty staying organized, but working memory is something that we would want to consider. not to cut this discussion short, but I really want to kind of have that more nuanced conversation around like what else could be at play and how are we thinking about supporting her. So I'm going to move on to those because I feel like we had some really nice and just rich conversation around, or rich sticky notes, if you will, around like what could be happening and what's important to consider. So tell me about Sarah. So people brought up really important things to be thinking about with Darnell. What about Sarah? What else do we want to know about her that would be important? Language skills. Yep. Sensory processing. Yeah, absolutely. What are other things? Yes, triggers. I'm going to put that under kind of near sensory processing to kind of get at the fact that we want to understand why she, what might be kind of driving some of the challenges that we're seeing, and especially some of those emotion regulation. Yes, we want parent observation, medication. Yeah, absolutely. Just basic, like, are there things that could be, again, contributing to some of these differences? What are expectations at home? Yeah, and does she need support? Sensory systems. Yep. Medications. Does she have siblings? I'll put that under our home. Are her EFs some? Yeah, I appreciate you bringing this up, which is we always, I put that little note about her cognitive skills in the case study because we want to understand a child holistically, and to understand how they are doing. Now she is, developmentally or cognitively, doing, performing or academically kind of right around a fifth grade level. And so that does help us kind of, understand who she is. Triggers. Awesome. Yes. So I grouped these again based off of common themes that were popping up, not too different than Darnell. We want to understand what's driving these challenges. So what are some of those triggers that are causing her or making certain situations hard and making her more likely to react emotionally. I think, again, like really honing in on those triggers could be a lot of different things, right? It could be difficulties with flexibility, right? It could be sensory differences, but really trying to tease that out because it's going to help us understand how we support her. And I'm just putting these things here. Again, we want to understand just like her skills in other areas. We want to understand her as a whole child, to understand developmentally where she's at. Triggers and reaction. And then observations from home. The last piece, I grouped it over here, but I think is really important. And this came up with Darnell as well, which is we want to understand what level of support does she need? How much support are her teachers giving her right now? And how much is this getting in the way? I mean, my take on the case study without actually knowing Sarah is that if she is, walking out of the classroom and forgetting things and, perseverating on specific topics, and it's probably making school and friendships hard. Not to mention that it just like, it stinks when we feel crummy or are upset. So my hunch is that these things are getting in the way, but it would be worth understanding to what extent. Awesome. And then our last question here is, what strategies like Darnell might you consider to support Sarah? Again, this is going to be the focus of the webinar in 2 weeks from now, but knowing her and knowing that we are already seeing emotion regulation challenges, potentially sensory differences, having a hard time with planning, and also maybe some rigidity. What are you thinking about? Awesome. Same things. Use of visuals. I love that. Teaching skills. I'm just going to put these in like the same groupings that we started to have before. Teaching skills, planner. Wow, lots of planners. Instruction, teaching, love this. Task analysis. Yep. So breaking down what she needs to do. I'm going to kind of put that over here. Giving her some set time to talk about. I love that. So again, kind of helping her know, I'm going to put this over in teaching, but helping her know it's kind of an environmental change, but also helping her know when and how to kind of shift in conversation. What reset button works best for her? Yeah, thank you for bringing this up, giving her some strategies to kind of support her regulation, right? Whether that be kind of taking a walk, getting a drink, taking some time. I'll put some of these together. Planner, ways to control her emotions. Beautiful. Oh, this is awesome. So breaks, I'm gonna put that here. So we have similar domains. I'm doing my best to keep up with everyone. I'm gonna put that over here too. So we have similar to Darnell, I tried for my own organizational sake to keep the same pattern as our last case study, which over here we got a teacher, right? You know, we got to support her in knowing what's expected. And we're going to talk about this in 2 weeks, which is like, how do we teach effectively and really set kids up for success so they're not so reliant on adults to use and be reminded of what to do. We want to teach her these things. Absolutely. When we think about emotion regulation and mental health, we got to be supporting her and understanding how she can manage some of her emotional reactions and experiences. That's a skill that we all work on. We work on it into adulthood. We want to break down and help her kind of like understand what's expected of her and when. And I love all the use of visuals like last time, you know, and for older students, right, that is, you know, it's both, it could be true visual supports like we were talking about for Darnell, but it could also be visual tools to kind of help with planning and organization. And so I group planner under that for that reason. I'm gonna put visual aids over here. And again, a social skills group, I put it over here, although it is kind of similar. In some ways, it's similar to this grouping of sticky notes here, which is around, we have to make sure we teach her skills. Yes, giving them the option to ask for help or that they need more time, teaching them how to advocate for themselves. I think that's a really important skill to be hitting on. When I think about teaching skills, I often think about, you know, obviously teaching emotion regulation. I think about teaching kind of how to flexibly shift, how to have a plan B or a backup plan. But also really we want to make sure our kids can advocate for themselves and recognize when they need help and support. So I am going to, I'm just looking at our time. I'm going to stop and I'm going to go back to our slides real quickly and just take a look at the chat box. Let me just make sure I've caught everything here. Great, I'm seeing some of these things. Okay. So I want to just, we have about 15 minutes left. We are wrapping up and I want to say, please, we have a GIPRA survey that we're going to be dropping in the chat box for you. That's your way of providing feedback on this webinar content. We'd love to hear from you. It's also how we've kind of developed or thought about content for webinars like these. So Sarah will be dropping that in the chat box and we just ask that you fill that out. I want to give a preview for where we're headed. We are headed in 2 weeks into thinking about, okay, so what, right? You know, we just saw Darnell and Sarah and they, you know, we talked about the different challenges and how we might group them and but like, what does that actually mean for me and how might I support them? And so part 2 of the webinar series is going to be geared just towards that exact question, which is it will be providing an overview of evidence-based approaches to supporting executive functioning in autistic students. And so this slide just lists some of the objectives for that webinar, which is we want folks to leave being able to describe evidence-based approaches and strategies to support executive function, to identify strategies that could be used within case studies, and to know where to find additional resources when you kind of move forward and, you know, continue to work with these students. I just want to give a preview for some of the specific strategies and skills that we're going to be talking about in 2 weeks. You know, we again hit today that executive functioning is a broad domain. There's a broad construct that has these different domains in it. So when we think about supporting executive function, right, there's a lot to talk about. And so we're going to be focusing in specifically on strategies to support flexibility, strategies to support planning, strategies to support kids and inhibiting and kind of staying on task, if you will. And then we will talk about emotion regulation because I think that's really important. And again, we're hitting these things primarily in 2 weeks. All right, so I just want to end, whoops, I'm going to go back here, end with a polling question. And this is going to help us, again, just finalize the content for the webinar in 2 weeks and make sure that we're hitting on the things that you want to know most about. But when you think about executive function and executive functioning differences, what are things that you're most interested in learning strategies to support? So when thinking about students, which situations do you want support managing? Give people maybe like 10 more seconds to fill this out, and then we'll share it out just so we can see what people say, and I'll make sure to hit on one of these things will be covered in a couple of weeks. All right, I'm gonna pin poll, and I'm just gonna share it out so you can see. So this is what folks said in terms of, the question was what things do you want to talk about, and like what situations do you want strategies for? And so the most common, I just want to make sure that I'm saying this right, is and not missing something, is being easily upset or frustrated. So thinking about emotion regulation, followed by becoming upset with changes in routine, having rigid perspectives, zoning out in class. This is fantastic to know. And I just want to hit that those things will be covered in a couple of weeks. We're going to talk specifically about flexibility, which is critical and a really important skill for kids to both be taught and to practice. It's important for us as adults too, and it's not always easy. So we'll be talking about flexibility. We're going to talk a whole lot about emotion regulation. That is something that I am very excited about and care a lot about. And we'll also be talking about inhibition and planning strategies. I just want to say thank you. This is information here. We have the link to the Southeast MHTTC website. My email is on this slide. So if you have questions, you're welcome to email or to contact me. I'm happy to connect about questions related to executive function. And we have here on this slide just kind of other information for about upcoming events. And finally, I know that this was dropped in the chat box. I just want to reiterate that this GIPRA survey really helps provide us with feedback on the content of the webinars that we're providing. And so we just ask that if you have time to fill that out. We have time does fly for whoever put that in the chat box. I feel like it just does. It is, I'm just looking at the time, it is 1:18. And so we have about 10 minutes or so to, I have 10 minutes or so to kind of answer questions that come up. And so I'm going to just open up the chat box for questions. I'm just going to scroll up to make sure I haven't missed any. I see some related to the survey. There have been a couple of questions around credit for attending the webinar. I am not the best equipped to answer that question. Could you bring the slide back prior? Oh, yes, absolutely. Let me go back so you can see some of those resources. There you go. Oh. I think maybe this slide. Let me know if that was right. I just want to say thank you again for taking the time to hop on this afternoon to listen in to our webinar. I'll be on for a little bit longer, so if there are questions, you're welcome to continue to drop them in the chat box. And again, my email is on this slide, so you're also welcome to reach out with additional questions. But thank you. I hope everyone has a really nice rest of their day, and I hope we get to see you in a couple weeks when we talk actually about strategies.
Will you please send me the evaluation again?
Yep, yeah.
In the chat box?
Sarah. Yeah.
Thank you.
Yeah.
There we go.
I do see the question around accessing this presentation. The presentation was recorded and I believe will be posted on the MHTTC website and sent out through potentially through the listserv. But Sarah and Josie may be able to clarify that. Thank you, Sarah.
Yeah, it'll go out through our listserv, and then we'll also send out an evaluation reminder. And the recording will be included in that when it is ready.